Welcome back. USC women's hoop superstar Juju Watkins tore her ACL last night and is done for the season. The injury happened early in the first quarter as Watkins tried to dribble through two defenders. After hitting the ground, she immediately grabbed her knee and was eventually carried off the floor, unable to put any weight on that knee. We now know that she tore her ACL. And joining us now is orthopedic surgeon Dr. Matthew Donovan. Doctor, thanks so much for taking some time with us. Can you first off explain and maybe even show us what it means to tear your ACL?
Sure. The ACL is a tough ligament which runs in the center of the knee, this being the femur bone, and here the tibia. This is the ACL. It stabilizes the knee so that your tibia doesn't sublux or dislocate forward, and 85% of the stability comes from the ACL. It's a tough ligament made of collagen, the same thing tendons are. And if you've ever tried to gnaw through a piece of white meat on your steak, you know how tough it is. Functionally, it stabilizes the knee and prevents episodes of falls.
And doctor, do you have to wait a while after the injury to actually have surgery? And can you maybe explain to us what the surgery actually entails?
Sure. The most important thing prior to surgery is to regain motion, because if a person has a stiff knee after surgery, stability means nothing. The knee needs motion. So that can be regained anywhere between 2 days and 2 weeks from the time of injury, because the knee fills with blood at the time of injury. The long aspect of that is 3 months, 6 weeks to 3 months, because during that time of instability, further damage can be done to the cartilage and the meniscal ligaments. So anywhere between a few days and 3 months.
Wow. And generally after surgery, when does rehab begin? And what is the timeline of ramping up activities again?
Rehab begins immediately. Again, range of motion is paramount for recovery, and then strength. Typically, motion is gained, and then at about 3.5 months jogging and weight-bearing kind of impact activities can be done. Once this is accomplished, functional restoration with sport-specific activities can be administered by the physical therapists. At about 8 to 9 months of post-operative recovery, it's expected that most athletes can return to full activities.
Well, with the understanding that every knee injury is unique and not all recoveries are the same, but in your expert opinion, when is the next time we might actually see Juju Watkins playing basketball again for USC?
Well, in someone like Juju Watkins, I would anticipate her on the side of recovery at about, she'd probably want to go prior to 8 months. But most orthopedists, the consensus is that it should be 8 to 9 months before return to full athletic activities, especially those involving jumping and pivoting, which is basketball. And furthermore, ACL injuries are 4.5 times more common in women, and re-injury also would be more common. So I would tend to be conservative in her care.
All right, doctor, thank you so much for joining us and giving us some of your insight. We really appreciate it.
Thank you.